Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about inflammation, fibrosis and malignancy, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, evidence ideas, and some helpful tips to make candidates' portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the second subsection of the sixth section, principles of pathology, called inflammation, fibrosis, and malignancy. The knowledge requirement explains what knowledge is expected of the candidate in relation to the relevant subsection. Candidates should be able to demonstrate their knowledge at the specialist level. Think about what knowledge they had as a Band 5 BMS. How would that differ to the knowledge of a Band 6 BMS? That specialist level of knowledge would allow the candidate to troubleshoot, problem solve, verify or validate. The first knowledge requirement is acute inflammation and the related terms calor, heat, rubor, redness, tumor, swelling, dolor, pain, and functio lisa, loss of function. Candidate needs to have the knowledge and understanding about acute inflammation. You could ask the candidate to explain what is acute inflammation, to list signs of acute inflammation, to explain the mechanism of acute inflammation, to highlight microscopic features of acute inflammation on H&E stained section, to explain the terms calor, rubor, tumor, dolor, and functio lisa. When addressing this knowledge requirement, candidates should consider vasodilation and its association with heat and redness, increased permeability and its association with swelling, chemical mediators and their association with pain and outcomes, either repair or chronic inflammation, acute phase proteins that increase in concentration, systemic effects like fever and management via anti-inflammatory drugs like corticosteroids, microscopic features like edema, neutrophils infiltration, vascular changes, fibrin deposition, necrosis. The second knowledge requirement is cell types involved in acute and chronic inflammatory processes. Candidate needs to have the knowledge and understanding about cells involved in inflammation. You could ask the candidate to explain what is chronic and acute inflammation, to list the differences between them, to name cell types involved in acute and chronic inflammation, to explain why different cell types are involved in acute and chronic inflammation. When addressing this knowledge requirement, candidates should consider acute inflammation and neutrophils, monocytes, platelets, endothelial cells, rapid response, neutrophil-driven, chronic inflammation, and macrophages, lymphocytes, plasmals, fibroblasts, eosinophils, mononuclear cell-driven, prolonged response, reasons behind involvement of different cell types. The third knowledge requirement is neoplasia and the related terms, tumor, cancer, and oncology. Candidate needs to have the knowledge and understanding about neoplasia. You could ask the candidate to explain what is neoplasia and how it develops, to explain terms neoplasm, tumor, cancer, and oncology, to explain the classification of neoplasms, to name characteristics of neoplastic growth, to list microscopic features of neoplasia on H&E stained section. When addressing this knowledge requirement, candidates should consider benign, malignant, precancerous growth, clonality, as neoplasms tend to be monoclonal, structures like parenchyma filled with neoplastic cells and stroma containing blood vessels and supportive tissue, invasion and metastasis via which the cancer spreads, and symptoms like pain, bleeding or obstruction, architectural features like loss of normal structure, invasion, altered stroma, necrosis, cytological features like nuclear hyperchromasia, nuclear to cytoplasmic ratio, shape and size of nuclei, pleomorphism, abnormal mitotic figures. The fourth knowledge requirement is for you to know the classification of tumors on the basis of their clinical behavior and histopathological features. Candidate needs to have the knowledge and understanding about tumor classification. You could ask the candidate to explain what is tumor classification, how are tumors classified by their clinical behavior and by their histopathological features, to explain what is clinical staging and can that be used to classify tumors. Consider malignant, benign, precancerous and intermediate, tissue of origin and differentiation, stages 0 to 4 and TNM system where T stands for size of tumor, N stands for nodal involvement and M stands for metastasis, and WHO classification. The fifth knowledge requirement is typical features of benign and malignant tumors. Candidate needs to have the knowledge and understanding about features of tumors. You could ask the candidate to name the differences between benign and malignant tumors, to list their typical features, to explain how benign and malignant tumors would differ microscopically. When addressing this knowledge requirement, candidates should consider growth speed and pattern, presence of spread, invasion, or border, cell appearance, recurrence of benign and malignant tumors and whether they are life-threatening or not. The sixth knowledge requirement is metastasis and its pathogenesis. Candidate needs to have the knowledge and understanding about metastasis. You could ask the candidate to explain what is metastasis, how metastasis forms, how tumors gain the ability to metastasize, to list metastatic stages, to explain the role of angiogenesis in metastasis. When addressing this knowledge requirement, candidates should consider local invasion via motility acquisition, intravasation to enter lymphatic and blood vessels, survival in circulation and evading immune detection to spread, extravasation and exiting vascular system into new tissues, colonization and growth in new tissues, chromosomes and concepts like seed and soil theory, epithelial to mesenchymal transition by gaining migratory and invasive properties, premetastatic niche formation by releasing factors that prepare distant sites for future tumor growth, angiogenesis and new blood vessel formation to provide nutrients to rapidly growing tumors, organ specificity as cancers tends to spread to specific organs, as an example, breast cancers tends to spread to bones, lungs and brain. The seventh knowledge requirement is genetic basis of cancer and underlying molecular events in pathogenesis and progression. Candidate needs to have the knowledge and understanding about the role of genetics in cancer development and progression. You could ask the candidate to explain the genetic basis of cancer development, to list molecular events that can occur during cancer development, growth and spread, to name genes that can be involved in cancer development and progression. When addressing this knowledge requirement, candidates should consider oncogenes derived from proto-oncogenes by gain-of-function mutations, tumor suppressor genes and their loss-of-function mutations, DNA repair genes and their mutations and epigenetic alterations of gene expression without DNA alteration, initiation via mutation that usually leads to survival advantages, clonal selection and expansion where tumor cells expand faster due to acquired mutations, genomic instability due to higher mutation rates or chromosomal abnormalities, signaling pathway dysregulation usually by overactivation, and immune evasion by developing strategies to evade immune system, role of angiogenesis, epithelial to mesenchymal transformation, metastasis, and role of microenvironment. The eighth knowledge requirement is common forms of carcinoma and sarcoma, tissues of origin, and benign equivalents. Candidate needs to have the knowledge and understanding about carcinomas and sarcomas. You could ask the candidate to explain what is carcinoma and sarcoma, to name tissues they originate from, to give examples of their malignant and benign equivalents, to list organs or tissues where they are commonly found. When addressing this knowledge requirement, candidates should consider carcinomas and epithelial tissue origin, their common locations like breast, lung, prostate, colon, kidney, and pancreas, their types and benign equivalents like adenocarcinoma and adenoma, squamous cell carcinoma and squamous cell papilloma, basal cell carcinoma and actinic keratosis, transitional cell carcinoma and papilloma, hepatocellular carcinoma and liver cell adenoma, sarcomas and their connective tissue origin, their common locations like abdomen, arms, legs and retroperitoneum, their types and benign equivalents like liposarcoma and lipoma, leiomyoma and leiomyoma, osteosarcoma and osteoma, fibrosarcoma and fibroma, angiosarcoma and hemangioma. The ninth knowledge requirement is various approaches to studying the etiology and pathogenesis of cancer. Candidate needs to have the knowledge and understanding about studying cancer. You could ask the candidate to explain what is etiology and pathogenesis of cancer, to explain how etiology and pathogenesis of cancer could be studied, to list study types that can be used to study cancer. When addressing this knowledge requirement, candidates should consider descriptive epidemiology, case control studies, cohort studies, family studies, nested case control studies, genome-wide association studies, whole genome or exome sequencing, biomarker profiling, biome research, and experimental studies. For pathogenesis, they should consider in vitro cell models, cell cultures, organoids, in vivo animal models, genetic analysis, histopathology, imaging, studying tumor microenvironment, immune studies, population studies, or functional characterization. The 10th knowledge requirement is environmental carcinogens that could affect humans. Candidate needs to have the knowledge and understanding about environmental carcinogens. You could ask the candidate to explain what are environmental carcinogens and how they can affect human health, to give examples of environmental carcinogens, to list sources of environmental carcinogens. When addressing this knowledge requirement, candidates should consider various carcinogens like radon, asbestos, air pollution, arsenic, formaldehyde, benzene, heavy metals, pesticides, herbicides, dioxins, sources of exposure like air, water, soil, food. The 11th knowledge requirement is significance and the clinical value of tumor-associated antigens. Candidate needs to have the knowledge and understanding about tumor-associated antigens. You could ask the candidate to explain what are tumor-associated antigens, to list their clinical values, to name their role in diagnosis, monitoring, and prognosis, to explain their limitations, to compare them with tumor-specific antigens. When addressing this knowledge requirement, candidates should consider their role in diagnosis and screening, their use as prognostic tool, detecting recurrence, monitoring treatment and progression, to study tumorigenesis, help with immunotherapy development, their limitations, future directions to improve their sensitivity and specificity, their use in combination testing to improve accuracy, and key differences between tumor-associated antigens and tumor-specific antigens. The 12th knowledge requirement is link between classification of diagnosis and therapy. Candidate needs to have the knowledge and understanding about the impact of classification of diagnosis on treatment. You could ask the candidate to explain why is classification of diagnosis important for treatment, how can diagnosis classification affect treatment options, the link between the treatment efficacy and diagnosis classification. When addressing this knowledge requirement, candidates should consider that disease classification is directly linked to therapy, informs treatment selection, helps with treatment planning, allows targeted care and therapy which makes it more precise, physical versus approaches, helpful for research, clinical trials and evidence-based practice, improves communication and resources for healthcare providers. The 13th knowledge requirement is application of cellular pathological techniques in the identification of inflammation and fibrosis. Candidate needs to have the knowledge and understanding about techniques to identify inflammation and fibrosis. You could ask the candidate to name histological techniques used to identify inflammation and fibrosis in tissue, techniques to examine them, techniques to quantify them. When addressing this knowledge requirement, candidates should consider inflammation and role of H&E, special stains like Gram, PAS, Giemsa, or Grocott, IHC stains like CD3, CD4, CD8 for T cells, CD20, CD79A for B cells, or CD68 for macrophages, molecular imaging like PET scan. For fibrosis, role of special stains like Masson trichrome, EVG, Victoria blue or Redic, IHC stains like SMA, fibronectin or collagen, label-free and stain-free imaging technique to visualize collagen fiber density, orientation and cross-linking, application of pathological techniques like staining to visualize inflammation and fibrosis, microscopic examination to detect, quantify and assess severity of inflammation and fibrosis. The 14th knowledge requirement is for you to know the principles of screening for malignant disease and the role of cellular pathology in diagnosis. Candidate needs to have the knowledge and understanding about screening programs and role of histology. You could ask the candidate to explain the principles of screening for malignant disease, to name roles histology plays in diagnosis of malignant diseases. When addressing this knowledge requirement, candidates should consider the importance of the screened condition. Must be a major health problem like cervical cancer. The disease progression has to be well understood with detectable signs and symptoms. There have to be suitable tests for accurate, safe detection, accessible to the population, tests that can detect early cancer or precancer state. There has to be effective treatment, the importance of the balance between potential benefits and harm, and facilities for diagnosis and treatment must be available. Histology roles like analysis on cell level via FNA or fluids, early detection, analysis on tissue level, provide definitive diagnosis, enable staging, grading, and margins assessment, enable use of specialized techniques like IHC, or molecular tests to enable advanced diagnostics. Competence requirement is basically a combination of knowledge, skills, and experience candidate needs to perform a job to a satisfactory standard. Candidates' chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this subsection. The first competence requirement is state the histological appearance of malignant cells, using appropriate terminology. Candidates should be able to use appropriate terminology to describe malignant cells. Can the candidate recognize histological appearance of malignant cell? Can they use appropriate terminology to describe malignant cells? Addressing this competence requirement, candidate could consider nuclear atypia like pleomorphism, size and shape variation, hyperchromasia dark staining, nuclear to cytoplasmic ratio or mitosis, cytoplasmic changes like basophilia, scant cytoplasm, presence of inclusions or vacuoles, architecture and anaplasia cells appearing primitive, dysplasia, poor differentiation, loss of polarity, discohesiveness and cell mobility, invasion, necrosis and desmoplasia. The second competence requirement is list the common types of cancer and their location. Candidates should be able to list cancer types and their location. Does the candidate know the common types of cancer? Do they know their location in the body? When addressing this competence requirement, candidate could consider cancer types like carcinoma, sarcoma, leukemia, lymphoma, myeloma, melanoma, and cancers of central nervous system, locations like breast, lungs, prostate, skin, head and neck, testis, brain, bones and others. The third competence requirement is describe the current state of knowledge about the molecular basis of cancer. Candidates should be able to describe the current knowledge about molecular basis of cancer. Does the candidate know about the current molecular basis of cancer? Do they know the genes and pathways currently known to be involved in cancer development? Do they know about recent studies that influence the knowledge about the molecular basis of cancer? When addressing this competence requirement, candidate could consider research in genomic instability, oncogene activation, tumor suppressor gene inactivation, DNA repair genes mutation, genetic mutation accumulation, uncontrolled proliferation, cell cycle disruption, clonality, microenvironment, evasion, metastasis, epigenetic alterations like DNA methylation or histone modification to silence genes, and metabolic shifts to support rapid growth. The fourth competence requirement is describe the multi-stage nature of cancer and be able to discuss factors that influence this process. Candidates should be able to discuss multi-stage nature of cancer. Can the candidate describe the multi-stage nature of cancer? Can they name the stages? Can they name the factors influencing the process? When addressing this competence requirement, candidate could consider multi-stage nature like initiation and genetic mutation, promotion and clonal expansion, progression and malignant conversion, metastasis and spread, factors like lifestyle and smoking or obesity, environment and exposure to radiation or chemicals, biological agents and viruses or bacteria that can cause cancer, for example HPV, Hep B, Hep C, H. pylori, genetic factors, and inheriting faulty genes, for example BRCA1 and 2, or Lynch syndrome and immune suppression and AIDS. The fifth competence requirement is distinguish among the known genetic mechanisms leading to cancer and discuss methods of prevention in genetically susceptible people. Candidates should be able to distinguish genetic mechanisms that can lead to cancer and possible prevention methods. Can the candidate name genetic mechanisms can lead to cancer? Can they list prevention methods used in genetically susceptible people? When addressing this competence requirement, candidate could consider oncogene activation, TSG inactivation, DNA repair gene dysfunction, epigenetic changes, DNA hypomethylation, promoter hypomethylation, histone modification, microRNA dysfunction, driver mutations that provide growth advantage to cancer cells, mutation accumulation over time or chromosomal rearrangements. Prevention methods like genetic counseling and testing, surveillance, prophylactic surgery, chemoprevention, lifestyle modification, targeted screening, regular imaging, clinical trial participation, detection of biomarkers or family planning and reproductive options. The sixth competence requirement is recognize the histological appearance of inflamed tissues. Candidates should be able to recognize inflamed tissue. Can the candidate recognize inflamed tissue? Can they recognize histological features of inflamed tissue? Can they differentiate between chronic and acute inflammation? When in this competence requirement, candidate could consider their training and competence, microscopic examination of tissue, acute versus chronic inflammation, key features of inflamed tissue like presence of neutrophils, vascular changes, edema, or fibrin deposits in acute inflammation. Presence of lymphocytes and plasma cells, repair, granulomas, fibrosis, angiogenesis, and tissue destruction in chronic inflammation. The seventh competence requirement is list the causes of inflammation. Candidates should be able to list causes of inflammation. Can the candidate list causes of inflammation? Can they list causes for acute and chronic inflammation? When addressing this competence requirement, candidate could consider acute inflammation and causes like infection, trauma, foreign body, toxins, irritants, and tissue death, chronic inflammation and causes like autoimmune disorders like lupus or arthritis, persistent infections, untreated acute inflammation that progresses to chronic, lifestyle factors like smoking or obesity, chronic stress and raise of cortisol levels which promote inflammation, underlying conditions like type 2 diabetes or COPD. Each section also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each section. When they complete all the subsections within each section, they will be required to write a reflective statement. They also need to write a personal reflection on their training and why they chose their evidence. To prepare for that, ask them to write a smaller reflective statement for each subsection. What is their role in context of this subsection within the lab? What does their evidence demonstrate? Ask them to write a smaller justification as to why they chose their evidence for this subsection. Also ask them to write about what was their training like when to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier for them at the end of the section. Each subsection also has evidence of achievement. This is a part where you, the training officer, sign the candidate off as competent and fit to practice as a BMS at the specialist level. By doing that, you will confirm that the candidate can work in accordance with local SOPs relevant to this subsection. This will also confirm that candidate has answered questions set by you to test their knowledge and skills relevant to this subsection. And you will also confirm that candidate's chosen evidence demonstrates their competence relevant to this subsection. The candidate will need to be signed off as competent by an internal assessor for each subsection. They can be signed off by you, the training officer, senior BMS overseeing relevant section, or by the training lead. These are some example questions you could give your candidate to test their knowledge and skills about this subsection. These should be based around the knowledge and skill requirements mentioned earlier. These are some more example questions you can ask your candidate to complete, to test their knowledge and skills about this subsection. These are some more example questions you can ask your candidate to complete, to test their knowledge and skills about this subsection. These are some more example questions you can ask your candidate to complete, to test their knowledge and skills about this subsection. Supporting evidence should be selected by the candidate. It needs to be based around the competency requirements, and be relevant for each subsection. The evidence should allow the candidate to demonstrate their competence in each subsection. It should be specific and relevant to the candidate's in-house practice. It should also demonstrate candidate's specialist competence. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Link will be included in the video description. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs, or even videos, if they can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be you, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like case studies, for each subsection. They could use experiments, case studies, annotated results, annotated photographs of them performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose something that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the competence requirements in mind when they are selecting their evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirements for this subsection. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those requirements in mind when selecting questions and guiding the candidate. Bye for now.